If you enjoy this content, please take a moment to rate and review it. Your feedback will greatly impact our ability to reach more people. Thank you. And we're back. How's it going, man?
It's going well. It's warmed up a little bit here in Nashville. I'm kind of happy to have a reprieve from the wintertime stuff.
Yeah, I hear you. You know, this week, we don't really have much going on in the economy, right? I mean, it seemed like the market didn't do much of anything worth talking about. And most people
around, right? Not that much.
Yeah. And most people are trying to basically figure out whether or not this correction is a buying opportunity, right? Like, you know, did people take too much of a chunk out of some really good SaaS companies because they got fear that Claude is going to, you know, take over everything?
That's right. And I'm not sure myself. I think everyone in the market is just trying to kind of figure out where it's headed. So not much definitive to talk about necessarily. And then, you know, the Olympics are going on. There's lots of news in sort of in the public environment, but not really that applies to healthcare that much in the economy space. Yeah.
Agree. All right. Well, then with that, let's just go ahead and dig in. And let's start with VC deals. The first one is a company called Daffodil Health that raised $16.3 million for AI claims automation. Seeing a lot of claims automation deals happen in the VC space with some sizable, rounds. Company called Alafia raised $55 million in the Series B as well. But just to focus on this deal, Flair Capital Partners led the round. Participation from LRV Health and Maverick Ventures. Bringing the total funding to $20.9 million. Tell me a little bit about this deal.
Yeah, so they're trying to help employers manage their responsibilities to deliver health benefits more effectively, cut down on the administration costs, help with sort of managing the network. It's a big problem for employers. This is not the first firm that has tried to solve it, but I think good opportunity.
Yep. Agree. Anterior closes a $40 million round to accelerate health plan AI adoption, bringing their total funding to $64 million.
Yeah. So this is much more directly at the insurer side of the payer market, trying to bring AI into that system in a way that drives efficiency, but also has appropriate controls. The big news was Geisinger, the health plan side of Geisinger has adopted this.
Okay. Health plans operated by health systems have been struggling because they're small, right? And that lack of size with the higher MLRs is really, really tough to navigate. So I think AI adoption inside of health plans is going to be really important to getting these things back viable again, don't you think?
Yeah, I mean, I think it's going to be it'll be interesting in these sort of integrated networks where they have the payer and provider, because I think they could really drive a lot of efficiencies from both sides. Whereas the traditional market where you have health systems then billing another entity that is the insurer or payer, seems like more of an arms race where both sides are gearing up to, either file claims more accurately or get paid more, or on the other side, payers trying to review things more carefully or push back more. When you have it all inside Geisinger, I think there's a much more likelihood that they will sort of work at both sides together and get to what's the right answer, and not so much of an arms race dynamic.
Yep, agree. All right, let's move to policy, because definitely more things going on in the policy world in healthcare. So, story from the Wall Street Journal: a top FDA scientist explains why he quit after getting a promotion from RFK Jr. Lots of stuff coming out this week. A lot of outrage around the green lighting of continued use of Roundup. Just so much noise happening around not just HHS, but overall policies as they pertain to actual health, not the payments, but like the science of it. Talk a little bit about Richard Pazdur and sort of, why he is, why he quit.
He's the latest in a series of fairly high level experienced people at different departments of HHS sort of, in this case, retiring, but retiring because he feels like the administration is going in a direction that he's not comfortable with. I think he was frustrated that policy decisions were made without really engaging the staff, more like, we're going to go this direction. And he was told some policies that he felt like he should have been consulted on before they were decided. I kind of sort of see both sides of it. I think that's right. We have experts beneath the political appointees in these agencies. There are experts that should be not political, apolitical, and look at the science. And at the same time, I understand that elections have consequences and you bring in the political appointees in order to shape the policy. So there's been this, it's maybe a tradition or a culture of, even though the policy theme is in one direction, really, let's check with the scientists, let's check with the experts and make the best decision. And I think he was frustrated that that is shifting now towards more of a political decision and less of a science-based decision.
Yeah, it does seem to me that there's been a lot of frustration around how slow the FDA has been for quite some time. And I think the combination of the political climate in America today with that desire to reform the agency could be pretty jarring to many of the people who work there, right? And I do think it's a combination of both things, kind of what you articulated, right? Which is, on one hand, I do think there was a need for some level of reform because we obviously have far more innovation that is being developed out in the market, at universities than the FDA was equipped to process. And at the same time, that is overlaid by a political environment that seems to have agendas that don't totally bear out pure scientific and commercial reform, right? And so I think that combination kind of distorts our ability to sort of tell what's good reform from what's a political agenda. And that's a challenge, because I was certainly, prior to this administration coming in, somebody who felt that there was a need for thoughtful reform of the FDA so that we could better absorb the innovation that was being developed. And now it's sort of harder to tell.
Yeah, no question. I mean, my view is that we needed to make reforms, and that longtime employees of these administrative bodies would not be naturally inclined to any kind of cuts or changes.
Sure, right.
And at the same time, I think there is a valid point that if we're going to have scientists and have scientific rigor around these decisions that involve human life and healthcare, we should then listen to them and at least involve them in the decision. I would say that I don't think leadership, whether it's Kennedy or someone else, needs to do exactly what the scientific experts say, but consulting with them seems like it would be a healthy part of the process. So I think it's kind of both end.
Yeah. So, like I said, I think that the political agenda that is currently underway is unavoidable. Like, you can just look at the Super Bowl, right? I mean, there was almost no chatter about the actual game, right? It wasn't the Super Bowl, it was the Bad Bunny Bowl.
Right.
You know what I mean?
Yeah.
And the real fandom was about whether or not you were in support or against Bad Bunny. I mean, it's just the reality of the political climate of the United States today, right? It's we didn't care about the game, right? So science,
Right.
You know what I mean?
Right.
Like, we didn't care about the game. We cared about the halftime show. We cared about the pomp and circumstance. We cared about the culture war.
Yeah, I mean, partially the game wasn't that exciting, but yes, I agree. I think the point is right. Yes.
Yeah. So the next story here is that RFK Jr. continues leadership shakeup, placing top lieutenant in charge of the CDC. So Jay Bhattacharya, who we talked a lot about last year, who was likely to be a rising star given his, I hesitate to call it whistleblower, but certainly anti-establishment positioning during the COVID pandemic, and specifically around vaccines and the research that was going on during that time, and sort of the treatment of professors during that time. Dr. Jay Bhattacharya is going to temporarily lead the agency, which hasn't had a Senate confirmed leader since August. So RFK is continuing to elevate, the people who are aligned with the positioning of Maha and the political agenda of the Trump administration. I think it's a little tough, right? Because when people are elevated inside of this administration, even when they are very, very credible people, I think Marty McCary, Jay Bhattacharya, I think these are, really, really smart, credible people. The Ascension brings with it questions, because we know the nature of the Trump administration's requirements for Ascension in their organization, which is, at the end of the day, competency, paired with loyalty.
Yeah, that's right. And I think that it's not a good sign to have this revolving door at CDC and bringing Bhattacharya in, who is very well qualified, but also supposed to be running NIH, which is a full job in itself. It just makes it seem like there's not enough breadth of talent that has that sort of depth of science and background, and also full allegiance to the Trump administration, which is disappointing. I mean, there's a lot of talented people in the U.S. I think Jay Bhattacharya is great, but doing two jobs, leading both organizations, is going to be a tall order.
Yeah, and I think you actually, combining these two stories, you have a situation that is hard to reconcile, right? United States, certainly a world leader in medical innovation, a world leader in medical education, should have the talent in abundance to lead these agencies, and yet, has to have one talented person running two major components of HHS. And why is that, right? Why the drought in people willing and able to step up into these leadership positions?
I think that's right. It's a really challenging political environment. If you're a scientist, even if you are neutral, joining this administration, you're going to have a lot of coworkers, peers, other people that are not happy. So I don't know. It's unfortunate that there's so much one side versus the other in our political climate, and I think it's affecting HHS's ability to bring in talent. Now, partially, it's a self-inflicted wound that they are sort of demanding a certain level of trust and reliability on the Trump kind of platform. But at the same time, I think it would be, I'm old now, so the days when CDC, NIH, FDA were scientific organizations without a political bent, seemed like they were better times. But
agree. Okay, so starting to blend here. This is a policy story, but it starts to merge into the payer world. Payers sign pledge to join CMMI Access Model. This is Fierce Healthcare. I really feel like, Vic, in our world, the Medicare Access Model really ruled this week in terms of news that people were focused on. On last week's episode, we talked about the Chartist report on the state of rural health. And I think the conclusion that you and I came up with as we looked at the numbers and we looked at the trends was that there's going to be AI and robots taking care of people in rural America because the economics simply do not work. This is both in terms of the viability of the current business models and the availability of talent. Like, both were clearly trending in the wrong direction. And so we were going to have to leverage technology. And it feels like this week we got confirmation of that. As the access model rolled out, people saw what the rates were. And it's pretty clear that the access model is looking for solutions for caring for people in rural America that don't have a human in the loop, that are AI and tech enabled only, where the dependence is actually on the person to partner with AI to take care of themselves. So I think this is like a first, right? I mean, in the whole time we've been talking about AI human in the loop has sort of always been a core part of this. And the access model ushers in a new era of tech first, tech only care models.
Yeah, no question. And I think it's a positive thing. I mean, there should be often a human in the loop, or a human that is helping translate for the patient what they should take from this blood pressure monitor or glucose monitor or scale. And at the same time, we don't have enough people in healthcare. So we have to find a way to use technology to extend the experts that we do have. So I think it's really positive for CMMI and CMS in general to be sort of continuing to experiment with how do we do this? How do we bring care? We're using technology. They're focused on chronic care and using wearables and telehealth, which is great. And obviously, as a VC, I have a bunch of portfolio companies that are in this space too, which maybe biases my opinion, but I think it's really good. And I was pleased to see there's several Blues plans, maybe, 10 or 11 Blues plans across Tennessee, and then some bigger ones too, Care First, but then Cigna, CVS. So pretty large number of payers seem like they've signed on. So there's going to be pretty broad reimbursement for this access model.
Yeah, look, we were going to have to get here eventually, right? The number of hospital closures make it, the number of specialty facility closures were going to require this. It would be great to see this paired with sort of an official stamp on green lighting, I think, both telehealth and digital medicine. Why just do one aspect of it, right? Like, empower innovators to have the full stack of internet-based, digital-based, capabilities to deploy care models against these conditions that we have. But I think for now we'll have to settle with this access model that is still, being piloted out of CMMI.
Yeah, I think that's. I wanted to go more quickly as well, but I think the fear I had was that the Trump administration would cut all of the CMMI experiments, and they changed a lot, but they also announced this new one, which is good, I think.
Agree. Moving to systems, Community Health Systems wraps 2025 with narrow gains, flagging same store volumes. This is Fierce Healthcare. Give me the story on CHS.
Yeah, so CHS has been a several year sort of turnaround story in my mind.
Several year implies 3. I think it's like a decade.
Yeah,
now, right?
Yeah. So maybe it's, I don't know what you call it, a multi-year. And they have, they're beginning, I think, to come out the other side. They've cut their number of facilities to 65, which is a significant reduction. They've sold off facilities. And this was their financial statements for the year. And, pretty positive that they sort of are turning the ship. A lot smaller than it was previously. They have a lot of debt. They've had a lot of debt since, the 2010, 28. But I think making a lot of progress.
Yeah, look, I think that to me, the net operating, revenues look stable. We know that they've been in recovery mode for a while, mostly as a result of sort of selling off, many of the poor performing hospitals that they were unable to centrally operate to sort of, profitable ends. But it seems to me like they really are kind of turning the corner. And it begs the question for me, like, it seems like most of this work happened under Tim Hentigen's leadership, and he pretty abruptly ended his tenure. I think that there are still tough times ahead as the provider tax drawbacks start to kind of roll out in 2027. But I am curious why he's not in the seat right now, getting to take a bit of a victory lap for doing a lot of the really, really hard work over the course of the last 5 years.
Yeah, I don't know that story between the board and Tim at all, but I agree. I think there was a lot of great work done. We're just now, these things are time lagged, right? So the work that was done maybe 2 years ago is now produced. They turned to profitability, $500 million in profits last year. huge change from losing 500 million the year before. So
yes.
Anyway.
Yes. All right, let's shift to CommonSpirit. So CommonSpirit's volume gains, efficiency initiatives fueled noticeable quarterly performance bump. Remember, we did a whole story on CommonSpirit when we were first starting this podcast. But they are part of the group, CommonSpirit and Ascension, I think, that have both continued to execute a pretty strong turnaround. And their adjusted operating margin inched into the black during the 3 months ending December 31st. So that's fantastic, right? Getting back into the black after multi-billion-dollar losses, just a few years ago. Seems like a really strong turnaround story here with CommonSpirit as well.
Yeah, no question. They have done a good job. I think it really started with culture. They put in a whole new culture of sort of getting their operations better, becoming more of a cohesive team, and we're starting to see the benefits of that. As you mean, similar with CHS, they're not out of the woods. There's a lot of challenges coming ahead for all these systems, but it's great to see them sort of turn the corner and be much more functional as an organization. And it's decent size, and they're now turned profitable for at least for a quarter.
Yeah, agree. And now Ascension posts net profit as it looks to outpatient growth. Catholic Health System continues to realign its portfolio as it divests inpatient facilities and grows its ambulatory care and outpatient operations, which is the transformation that we would have expected them to make. This is Healthcare Dive. Let's dig into Ascension, Vic.
Yeah, so Ascension is probably one of the strongest nonprofit platforms, and they continue to do really well. So I'm not as surprised about that. I sort of expect Ascension to continue to perform well, but it's great to see them doing so.
Ascension earned $608 million in net income for the 6-month period ending December 31st, 2025. That is more than double the $277 million notched in the prior year period. So that is fantastic.
Yeah, I mean, they grew revenue and also decreased operating expenses. So that combination obviously is it's hard to execute, but really great if you can do it.
Yeah, agree. So congratulations to all the folks at Ascension. I got a couple of texts I need to send out to some of our friends over there. Okay, let's shift to a story on Alzheimer's, Vic. Starting with this Wall Street Journal story, why doctors can't agree on how to diagnose Alzheimer's. Divergent diagnostic criteria is raising concerns that some patients are being misdiagnosed and unnecessarily treated. What's the story here?
Yeah, so we have a couple different Alzheimer's groups, Alzheimer's Association, and then an international working group of neurologists focused on Alzheimer's. And they have not agreed on what the diagnostic indicators are, or how a doctor should diagnose whether a patient has Alzheimer's or has dementia or is aging and has sort of natural cognition changes, but not really one of those diseases. The Alzheimer's Association requires the presence of protein amyloid, but that's it. And this international group added amyloid, but also tau, which I had not heard of, but is another marker, another biologic marker, and then the presence of cognitive symptoms. And so the international standard is higher. And I think there's a live debate with clinicians. We should probably have a guest show with a clinician on, but it seems like half or some percentage of clinicians are diagnosing with amyloid only, and the other percentage are looking for these other markers. It really confuses patients. They have a story of a patient in here who got diagnosed and then started treatment, but then saw a second opinion and they didn't think he had Alzheimer's anymore and took him off the treatment. And so it's a hard, I mean, this is a very, top of mind disease. It's really affecting a lot of people. We don't have good treatments, and diagnosing accurately and ideally early would help with the treatment options, but we can't agree, or so far they haven't agreed on exactly how to do that.
Man.
Pretty frustrating. It's a long time, and we still haven't got to a place where we fully understand even what is Alzheimer's from a diagnostic point of view.
Yeah, and I guess like that really changes the perspective on the drug manufacturers and drug discovery folks and the difficulty they have had cracking this code, right? I mean, if the clinician organizations can't even really agree on how to define the disease, that would impact the target that you would be going after, right? When you're trying to develop data and you're trying to build clinical trials and things like that. I mean, the downstream effects of not agreeing on what Alzheimer's actually is have to be very material to drug discovery and delivery.
Yeah, there's no question that if we can't define what are the markers that would signal that a patient should be diagnosed as Alzheimer's, it's really impossible then to develop drugs to target anything. So there's lots of things in the pipeline that are attempting to solve the symptoms. But I agree, until we have some clearly defined way to diagnose Alzheimer's, it makes it very difficult for clinicians, for patients, for the families, for drug discovery, for everyone, really.
Yeah, it's crazy. But then, in I guess some good news, the University of Exeter, and this is published in Science Daily, has a study that has spotlighted 3 familiar medicines that could take on an unexpected new role in the fight against Alzheimer's disease. The front runner being the shingles vaccine, but also Viagra is emerging as a potential drug that could show some promise against Alzheimer's disease.
Yeah, right. So I can hear it now in communities around the country. I'm getting on Viagra. It has double benefits. But seriously, I mean, it's great that we have promising candidates, which is what I would call these, to reduce the incident or help treat Alzheimer's. I already have taken the shingles vaccine, so I'm glad that I get an extra little benefit there that I didn't know. I'm not on Viagra. I got to talk to my wife about that. And then the last one is Rizzoli. It's a motor neuron disease treatment for motor neuron disease. That makes more sense to me. That it is at least in the the domain of the brain health neurology.
Yep, agree. That one tracks a little closer than maybe the shingles vaccine or Viagra.
Yeah, right. I mean, both these stories just highlight that it's pretty unknown what causes Alzheimer's, even how do we define what Alzheimer's is versus dementia. And then there's lots of things that could treat it that seem to have benefits, but it still seems like it's an emerging space, unfortunately.
Yeah, agree. So now wrapping up with our AI story for the week, starting with NYU Langone Health. Here's a headline from MedCity News. We're close to clinical AI with no human in the loop. So this is just kind of confirming where we are headed. Health informatics leaders at NYU Langone Health think fully autonomous clinical AI is coming in the next 5 years or so, with algorithms soon able to manage routine tasks like blood pressure medication, titration, and diabetic retinopathy screening without human oversight. They argue automation is not just about efficiency, but also a practical and necessary solution to workforce shortages and system inefficiencies. Been saying this for a while now, that this was inevitable, that quite frankly, the system was breaking at the value network layer and needed something truly disruptive to repair it. And AI is seemingly the answer, Vic.
Yeah. I mean, we have heard AI supporters and technologists and even entrepreneurs or VCs talking about this. This was the first time I've seen a health system, on the health system brand, NYU Langone Health, sort of officially saying that we are contemplating this. They haven't gone to it yet. Right. Within the next 5 years, they're not going to have a human in the loop. And that furthermore, that would be better results, better outcomes for the patients and for the system overall. I'm not that surprised that they can do it technically, but it was the first time I've seen a health system come out and actually say that in the press, which I think is a landmark or something to note.
Yeah, and I think it also being a really strong academic medical center brand is important, right? I think this is where we would look to hear this first. I think you want to hear it here first, right? From an academic medical center that is going to be taking on a lot of uncompensated care as the impacts from the One Big Beautiful Bill start to roll out over the course of the next 3-4 years. Also, in, quite frankly, a blue city, right, where they have all sorts of challenges, budgetary wise, and reimbursement rates are going to be really, really impaired. So it's like on one hand you see this brand, but you got to think about what are the implications for this organization. And I think the implications are they are staring at a very, very dire P&L scenario over the course of the next 5 years, and they have to start to push the agenda with clinical AI in order to make the bottom line work.
Yes. And they just went through the strike in New York City. I think Langone was a part of it. It got settled. But even though it got settled, they are agreeing to staffing levels, X number of nurses per patients that have been hard to operationalize. It's hard to hire the nurses, hard to hire the med techs. You just can't find the people. So I think that's all sort of intertwined together, that they're going to need to, they say in here, it's just the reality of delivering service to the number of patients we deliver to with the staff we have. They're going to need automation in order to do that successfully.
100% agree. All right. And then final story. This viral AI project went from side hustle to coveted prize in 3 months. Of course, we are talking about OpenClaw, formerly Moltbot, formerly Claudebot, but has now been acquired by OpenAI. Peter Steinberger, the Austrian coder who hacked together OpenClaw as a side project late last year, now joining OpenAI. Meta and XAI also held talks with him. An unbelievable turn of events really over the last 30 days. Seeing OpenClaw just totally take the entire AI world by storm and sort of again demonstrate that if you can build something that advances the viability and usability of artificial intelligence and large language models, it is a $1 billion proposition. So this is incredible. We've been talking about the one-person $1 billion company for a while now, and I think we have now found it. Not necessarily $1 billion in P&L, because OpenClaw is going to remain an open source project, but certainly the value accrued here and the acquisition garnered proves that one person leveraging artificial intelligence can create $1 billion worth of economic value.
It is really exciting for me, who I work with a lot of founders. I mean, Peter was a successful entrepreneur already. He's been a software engineer and sold businesses before. And at the same time, as you said, it was one entrepreneur. It took him 82 days from when he released the product to when he sold it to OpenAI. And they haven't disclosed the terms, but I think it was over $1 billion in just to acquire him. As you said, the
Yes.
actual OpenClaw is staying in an open source foundation.
Yes.
So it is incredibly fast and just shows the power of this technology to really scale.
Yeah, no, it's remarkable. There's been some great coverage, not just of the acquisition, but also of like the reality of OpenClaw. I'd say everything from the stuff that Jason Calacanis from the All In podcast is doing to sort of talk about how he's leveraging it at his venture firm. Obviously, we have been watching that very closely. To the guys at the Limitless podcast, who have been really digging into what the reality of using OpenClaw today is for the average person, the risk reward profile, and the reality that, OpenClaw it's at least in the modern GitHub era, right? It's hard to compare it to Linux because we didn't have things to sort of track the virality and the growth of a project like Linux back in the day. But in the GitHub era, where we can actually track how fast these projects are growing in terms of the usage and the stars that developers are ascribing to it, it's the fastest growing project, in open source, modern history. And certainly, AI modern history. And, I think it's important to sort of understand it's still really a developer tool. And B, it's risky. It's really, really risky. These things are stochastic. They're not deterministic. You cannot control what they do. And, I think if you pair this with some of the stuff we talked about, I can't remember if it was last week or 2 weeks ago, where we were covering, the safety disclosures from Anthropic about the various things that Claude did, when trying to shut it down, right? I mean, I just think, you need to sort of look at that and recognize we're not dealing with something that we have full understanding of or full control over.
Yeah, no question. There are significant security gaps, and it's very difficult for an enterprise of any size to really utilize OpenClaw as it is today. But the important thing that I think for our audience, or that I've taken from it, is that use case. Now, the security needs to be handled, and I think Jumpstart and lots of other people are looking at, okay, how can we take this use case and put it into an environment that's appropriate for healthcare investment, for instance, where you might have PHI. I wouldn't feel comfortable putting anything like that in OpenClaw because it's not secure. So I want to be clear about that. But that use case of there's an AI tool either on my desk in a Mac Mini or in the cloud, wherever, and I can send it a text message on Telegram or Slack or something like that, and it goes and does work without me. Maybe I'm headed to a meeting and I say, hey, can you get this competitive landscape put together? And then when I leave the meeting, it's done. That use case, people are just getting their head around now, but it really extends what one human can do. I mean, I've had success with a thing called Manus doing the same thing. It's a whole different way to think about how you might achieve the things you have to get done during the day. And I don't think we're going to put this genie back in the bottle. Like the internet at first, like every new technology, there's lots of flaws and security risks and things to watch out for. And it's such a big productivity enhancement that we're not going to put it back. We're just going to keep going, and there'll be new versions that come out that are maybe not so open and have some controls in place. But yeah, it's a whole new way to think about delivering work.
Yes, I agree with the productivity gains. I think that most people do not have their personal security setups well designed, and certainly don't ever have them audited, right? And so the idea that you give it access to anything that will help it be productive, and that does not expose any security risk to you, I find kind of laughable. Because I know most people store all sorts of sensitive data about themselves on their Google Drive and don't even think twice about it.
Yeah.
They don't even know it's there. Right. Yeah. And this thing is very resourceful. You know what I mean? It will basically say, okay, I was told to go do this. Oh, I couldn't find this thing. Let me see if I can find it somewhere on this drive. Right. And the minute that happens, now you're in a place you didn't prepare for.
That's right. That's why we said security like 15 times. The productivity is attractive, but you need to be careful. And I think it's worth it to move slowly in this, even though it's tempting, because there's trade-offs. It's not secure.
Yes.
And
yes.
Most people, including me, you won't know what the open vulnerabilities are until your credit cards, your information, your passwords are gone.
Yes. I think that's right. I think that's right. And again, that's why I think OpenClaw is a developer tool. Not that developers are somehow more secure personally, but developers understand how to create sandboxes in which you can run OpenClaw securely, right? They can create a vacuum sealed environment where OpenClaw only has access to things that it's been whitelisted to have access to, right? Whereas the average person doesn't know how to do that step. And so they're just going to run it on something that is merged with their personal environment. And to me, I think the minute you say that, you're exposed. The minute you say that you are running it in the same space as you store your personal documents, you're exposed.
Yeah, I agree. So unless you can code better than the AI tool that you're hooking OpenClaw up to, which I certainly can't, then you can't secure it because it will write code to work around whatever you put in place. There are software developers. Most software developers can design a system like that, but the layperson cannot. And so they think that they're covered because they put it on a Mac Mini, but they gave it enough information. And these AI systems, I mean, we've all played with them. They're very fast at like building a tool and then using the tool. And so OpenClaw is a lesson for founders and even business people of how much power is coming. But with that power, you need to be really cautious so you don't just open up yourself to, everyone using your API key at OpenAI, and then you wake up and you have a $100,000 bill that you have to pay.
Exactly. All right. Well, that covers everything for this week. I think next week we're going to be remote again. But next week we should have GDP numbers. And so while this week we kind of took a break on the economy, I think next week we'll be able to kind of dive deep a little bit into where the economy is right now and see if any of all this AI stuff that's causing a SaaS apocalypse on the stock market is actually advancing GDP in any measurable, discernible way.
Yeah, I'm excited to see it. In the fourth quarter, seemed like it was trending positive for GDP.
Yeah,
job growth has been pretty good, but we need to create a trend. I mean, a couple data points isn't enough. So,
agree. All right, man. Until next week.
Okay. All right. Bye.